All right, everybody, welcome to The Truth About Addiction and Recovery. I'm Scott Jones, and I have a special guest here today, and we're going to be spending a lot of episodes and a lot of time talking with this gentleman, Mo Yachnes, who is the CEO of Archstone Behavioral Health. And why don't you tell us real quick just about Archstone and, what it is?
Sure. First of all, thank you, Scott, for having me. It's a beautiful studio here. You guys obviously put together a professional spot, and I'm grateful to be here, and I'm humbled to be talking with you this morning, and I appreciate the time that you're taking to have this dialogue.
Of course, of course.
So Archstone is we're a full continuum of care rehab center in Palm Beach County, Florida. We have a detox, about 20 bed detox and res, and then about 25 PHP IOP. So really the full continuum. And what I liked about the program is that we're really a destination facility for folks to come to kind of hang their hat and really go through the entire process. There's no jumping into a van, driving to an office somewhere. It's a one-stop shop. There's certain relationships that are developed with the staff. The initial phase of treatment obviously is more complex, the higher acute care. So you meet your doctor, the nursing staff, as you're going through the hardest point of your life, which is the recovery, the initial detox phase. And then you're able to kind of stabilize on a medical level and really start to engage the nuts and bolts of recovery, if you will, on the same campus with the same staff. And if there's a hiccup or if there's a frustration or a question or a physiological reaction, you could go back to the doctor. You could go back to the nurse that saw you 2 weeks prior. So that's kind of really what is exciting about Archstone. To me, it's a one-stop shop, and we have all the levels of care in one facility.
I just want to point out, just when you're saying
Sure.
that, I just want people to understand how important it is that someone have the same staff when they're in detox and then they're in res and as they move on through their recovery, to have those same people so you don't have to keep rebuilding relationships.
Correct.
That's really important, right?
Because one of the most fundamental components, the initial phases of recovery, requires so much risk and that vulnerability when a person recognizes whether they're driven there by force, they're on their knees for the crisis, or by their own volition. I mean, everyone that shows up, that walks through the doors of a treatment center, at the end of the day, they want to be there. No one is happy being miserable.
Right.
And when they take those risks initially, and there's a staff that is able to capture that and then reflect that motivation when they're 2-3 weeks down the road, is so critical and helpful for the true continuum of care. And that's really the objective of the team at Archstone, to create an environment that is able to hold someone's hand throughout their continuum. And that's our commitment to our patients. That's our commitment to the staff as well. And really grateful to the team that we have. Quality care stems from quality people providing that care, and it's a person-centric team. All divisions work together. Everyone there has years of experience doing the work. So there isn't a presentation, if you will, that we haven't seen.
Right.
And we're able to help people create a roadmap for them for long-term recovery.
So I've obviously come out and spent
Yeah.
some time out there, visited with you, and one of the things I noticed is in a smaller facility like Archstone, and I'm saying smaller as compared to 100, 150, 200 beds, every staff member knows every client's name, including you.
Thank you. Yeah.
I see you walk around and they come right up to you and talk to you. That's different and that's important, right?
Yeah, thank you. Thanks for noticing that. And that is the type of company that we're building. It's really, addiction treatment is different than other businesses, if you will. It's really person-centric. And no one's born an addict. It comes with a backstory, and recovery needs to incorporate that backstory. Unconditional love, non-judgmental, interactions with people. And the way to do that is to create an environment where we're honestly and committed to that. And that's why I'm there daily. At my office is in the facility. I'm not just looking at spreadsheets all day. I do that before the day starts and after the day ends. But really, it's something that, personally on behalf of me as an individual, but really on behalf of the company, we push that hard. We discuss that, daily meetings with the staff. We want to understand each patient, their story, their world, and that's how you create a quality environment.
Absolutely. Now, for people who are watching this, and maybe you don't have experience in recovery yourself, or you're not somebody who's ever going to go to rehab, I want you to think about it this way. If you've ever had to go to the hospital and you felt like the doctor didn't even look you in the eye when they talk to you, and the nurses, they see your chart and that's the only thing they know about you, think about how frustrating that is for you if you have to deal with that. Now, think about going somewhere in the throes of addiction, the hardest time of your life, spending 25, 30, 45 days in a place and being treated that way. It would be ridiculous. It would be hard to get better. Unfortunately, there's a lot of models out there that do that.
Yeah, it's an awesome point and great analogy there, because we've all had those experiences where we're questioning, hey, does the provider really care about me? Is there a personal interest? Am I just a number? And our commitment is to battle that. I think that we're keeping it small and intimate. We're I would say a small size facility, and that's the goal. The objective is to have all the staff communicated with regarding each patient's care and what their trajectory looks like, and that's how you create that environment. So it's very strategic. The design is aggressive and important in order to create that environment for the patients that we serve.
And as you're listening to this, if there's somebody that that needs help, you can call Archstone. If you're not sure what to do and you just want to talk or get answers, do that. That's fine. Not every time you call, you're going to have to get the hard sell and everything's going to go on. This is about getting help for you or the loved one that you have, right?
Sure.
So we encourage people to call in Archstone.
Absolutely.
Get questions answered.
Correct. We have I would say a special focus on the family and understanding the systemic pieces of what a person struggles with addiction is going through. And for a lot of people, we become that family, and we help sometimes bridge the gap with their family members. And that's an important piece because ultimately families deserve each other, and people need to go back home and celebrate life and recovery in the truest sense. So we try to help recreate it and then pass the baton along back to the family of origin or the relationships of origin, if you will.
Absolutely.
Yeah.
Now, we've been dealing with this opioid crisis for a very long time. And now, I don't want people to get lost in the word opioid crisis. There's been a crisis in addiction, alcoholism, and everything else going on for a very long time. It's kind of taken a back seat because of COVID right now, and everybody's concerned about COVID. But I want to let people know that we've done our research. We know that overdoses are increasing. The amount of people who are getting in trouble or having issues with alcohol and drugs, it's going up. And it's going to continue to go up and get worse. So now more than ever, it's really important if somebody that you care about is in trouble, help them or reach out for help.
Correct. To that point, underneath addiction, which is really the objective of any treatment center, is, it's a two-step process. You want to obviously, put a stop to those pathological behaviors, if you will, and cut that cycle of use. But really, the goal is to look under the hood and to understand what's driving those behaviors and where is that person's issues underneath it. And what we've seen is just a deep, profound loneliness. And COVID, I think, kind of reinforced that or exacerbated that, where people are just alone. They're isolated. There's, we have government oversight, which is encouraging and restricting us from engaging with others for good reason. But I don't want to get too political here. But from a psychological and from an addiction treatment perspective, we're seeing an increase in numbers because of that, because the loneliness is reinforced, and then people don't know what to do with that. So obviously, drug use is higher because of that.
Absolutely, we're seeing the drug use, the relapse. The first responders have been so overwhelmed; they're not even able to respond sometimes in time. And it's because they have been, obviously, we've got everything from COVID to the riots and everything else going on and protests. There's so much going on. Really, just if you've got somebody you care about, that you got to get some help for them, because you're right. Quarantine. I mean, I get lonely. I don't know about you. I mean, It's like I'm used to going around and hugging and high fiving and doing all that stuff, and now we're bumping elbows, and you and I are sitting far from each other while we're talking.
It's a different world.
It is.
It's a different world, and unfortunately, people who struggle with the demons that drive addiction, it just gets reinforced through loneliness, and which is why we're seeing an uptick in numbers. And we've created a lot of regulatory and medical oversight in order to ensure that patients that come are safe.
Right.
In order to ensure that our staff is safe, we have actually a COVID unit. Specialized if somebody were to come in with certain symptoms and et cetera. I don't get into too many of the details, but we're in constant we try to stay ahead of the curve in that sense of to keep our staff safe and to keep the commitment strong, because the reality is that the consequences of addiction far outweigh the consequences of COVID, and that's a piece. We're a provider. We're here to to medicate, to provide some kind of treatment for addiction. And therefore our doors are staying open, and with all the headache and layers of protection, which we add and we have done, but we're our commitment is to help capture folks that are struggling as a result of COVID.
So I want to make sure that point is well made, that if somebody does come in and there is some symptomology going on, you do isolate.
Yes,
and
absolutely.
so you don't have to be concerned that if you do need help and go to treatment, you're not going to be exposed because you do your due diligence to make sure that doesn't happen.
Yeah, I mean, we're a healthcir facility, so we have all the bells and whistles of what that what that entails. We have up at, and you've seen the facility, so you've seen the layout and the structure, and this we will move past COVID, and we want to be there to help people who are struggling or which COVID has triggered some relapses, unfortunately. So that's our commitment. That's our objective.
Well, I'll tell you this. Spending some time there and getting to know some of the people there, yourself and Bree and Marie and Tyler and all those the whole staff. These are wonderful people.
Yeah.
How much effort are you putting into staffing there, as far as making sure the right people are there?
Yeah, that's a good question. A lot of my energy is spent in hand selecting our staff, and the reason for that is because it's our commitment to provide quality care, and quality care is comprised of people doing the work, and that's really, I heard a great quote from a very successful businessman. He said the way you want to be the less sophisticated person in the room. So you want to build a team that is more knowledgeable around the product, can understand the situation deeper and better, and that's how you build a strong team. It's not about me personally or my philosophy. It's let's get the smartest people who understand treatment well around the table to provide that quality.
Absolutely. And I have to ask. Ask. Why do you do this? I mean, this is a tough.
Yeah.
I mean, forget about it. Can really rip your heart out working in this, because unfortunately we don't always win.
Yeah.
We don't always win this battle. It's a tough business to be in.
Sure.
There's a lot of scrutiny.
Yeah.
There's even been a lot of bad press. Why do you put yourself through that? Why are you doing this?
That's a great.
There's got to be a reason.
There is a reason. So it's interesting. I'll be very transparent and vulnerable here. But I grew up in a home where helping others was a central focus. Both my parents are community people. My mom's an educator. She built a resource department in a pretty robust school system down in Miami. And those are the messages that we heard growing up, essentially. And so, doing what we can to facilitate somebody's happiness is a very strong message, and I feel proud to have fallen into this work. I do see this as a social and financial opportunity. I think that a smart business that's run well, can yield profit margins. But I would say underneath that is the ability to build a safe haven for people to get help and launch their lives. And that's something that I saw way before I went to school, way before I even knew what a career was. It's as a child, I saw people walking into my home, crying and walking out smiling. So that's where I would say that's where it came from.
Wow.
Yeah.
Now, obviously, we can't talk about anybody in specific terms,
Yeah.
but can you talk about maybe any moments where you've sat back and said, "This is why I do that"? Maybe
Yeah.
maybe some moments where you've seen some change or something happen.
Yeah, so that's a great. Thank you. It's a good question. It's something that I think about a lot because there is, it's a tough job, we're dealing with people who are struggling. We're dealing with government oversight, which is complex. But I would say the rewarding times come. We have a pretty robust alumni group. Archstone has been around since 2001, the company has done great work over the years. And through that, I've met a lot of people that have been through Archstone, have been through the company, and even more recently, with COVID, we've created a caveat and we do it online. But before COVID, for several months, we had a standing alumni group that would come to the facility. And when you see and you talk to people, you hear their stories. How they turned their life around, they changed their paradigm of thinking. It's a very rewarding job. You see people's courage every day. They're challenging the deepest demons, really to no fault of their own, by and large, not to justify behaviors, but underneath the behaviors are lonely and sick people. And when you see them put that courage forward, it's very inspiring. And that drives me. It gives me that energy. It gives me that that motivation to continue hustling and doing what I can to create an environment to help the next guy. So that's where the energy comes from.
Well, I appreciate
Yeah.
that. Again, this is the truth about addiction and recovery, and talking to Mo Yachnes from Archstone Behavioral Health. Archstone is located where?
We're in Lantana in Palm Beach County, Florida.
Okay.
Come check us out. Beautiful facility. I would say, we're a pretty transparent group, so call anytime, speak to the clinical director, speak to the medical director.
If they want to come and tour or talk to
Absolutely,
anybody,
sure.
certainly. Obviously, call ahead because of the COVID right now. I
Correct.
mean, it's a little more difficult, but still, it's important that you help everybody you can, right?
Thank you. Yeah.
Yeah.
Thank you.
Yeah.
And thanks for having me on this morning.
No,
It's,
I
it's
appreciate
great.
you coming on. I mean, again, we always have a good time conversating together and other things, and I want to make sure we get the message out. We'll come back, every once in a while and
Sure.
fill people in on what's going on. And certainly we want to encourage everybody, if you have any more questions or anything, you could reach out to Archstone. The number's on your screen and the website. Make sure you check that out. Any last words? I mean, maybe for families or people who are out there watching this and thinking,
Yeah.
I might need help.
Yeah, I would say that this can be done. Addiction can be beat. I've seen it with hundreds of people, maybe even thousands over the years. And recovery is just around the corner. Even though you can't see it, it's there and it's waiting for you, and you can do it.
All right. Again, Mo, thank you very much.
Thank you.
We'll give you the elbow right
All
there.
right,
There we
thank
go.
you.
Do the
Thanks.
elbow bump. And we'll catch you next time right here on The Truth About Addiction and Recovery.